again? Okay. Hey everybody, today I'm going to be talking about mental health awareness. According to the World Health Organization, apparently 1 in 4 people have a neurological mental health disorder that is diagnosed to them throughout their lives. The mental health stigma is worldwide, and many people feel unsafe or emotional or just afraid to understand their mental health disorder or understanding mental health disorders in general. They feel disapproval or shame of themselves for having any kind of emotional distress with mental health. A few of the common mental health disorders include anxiety disorders, which can make people stutter, affect their breathing, affect physical issues. Depression, bipolar disorder are all mood disorders. Disruptive behavior disorders can happen to many underage kids. Eating disorders, which can be bulimia, nervosa, there's binge eating disorders, or there's just eating disorders, anorexia. Obsessive compulsive disorder, which can really affect someone. Personality disorders can cause antisocial behaviors or people to not feel themselves or have 2 different personalities. There's PTSD, which is post-traumatic stress disorder, and this can happen to anybody who has had a significant thing happen in their life that has caused damage to their just mental health. And there's psychotic disorders, which can be schizophrenia, which can cause people to see or hear things. And there are many ways to promote mental health and well-being, such as just people getting regular exercise they need, eating healthy, staying away from the junk food and food that makes you feel like just bleh. Sleeping is a priority. Try relaxing activities such as going to do something you like, getting your nails done if you're a girl, or massage if you're a guy. Setting goals is a huge step in mental health. If you set goals, you can keep yourself on track with staying healthy, inside and out. Practicing gratitude and positivity, and trying to stay connected with friends or family, and trying not to be alone, because being alone can be really hard. And there are many ways that you can tell if someone is struggling, but sometimes it's not always as easy as you think. Some of the ways could be someone having less sleep, disrupted sleep, being more emotional than usual, having the loss of joy. They don't want to do anything they used to enjoy, like going on family walks or hanging out with friends, playing a sport. Change in appetite is a huge one. People can either gain weight or lose weight when they're stressed or going through something with just eating disorders. Worsening physical symptoms. Their mental health affects your physical health in a huge way, from weight to your heart to many other physical parts of your body. And many people will feel low energy and just be really tired, not wanting to do anything. And there are many different ways to seek help, from the different therapies. There's counseling, and a lot of times people will often use medications. The different therapies can include one-on-one therapy, which is a therapist and you just talk to a therapist alone. There's chemical therapy, which involves chemicals such as medications and therapy. And there's group therapy, which can be a group and a therapist, and people talk in a group together. Sometimes they feel better when there's other people that sometimes go through the same stuff as them and aren't awkward and alone. A lot of medications will work for anxiety symptoms, depression symptoms, bipolar disorder, but a lot of times medication will help with therapy. Checking in on your friends and family, creating campaigns or organizations can be a big, huge step in the path of ending the stigma of mental health. And most importantly, just being kind and thoughtful and respectful towards others. And you never know what someone goes through.
6 minutes.